Hello, everyone, and thank you for being here. My name is Julian Kent, and I'm serving as your telehealth consultant today. In this presentation, I'll walk you through how telehealth functions as an integrated system, one that connects patients, providers, policymakers, technology experts, and business leaders. I'll explain how each of these groups shapes the telehealth landscape, how changes in one area impact all the others, and why cross-sector collaboration is essential for building a sustainable and equitable virtual care model. When most people think about a doctor's visit, they picture waiting rooms, long drives, and in-person check-ins. Telehealth changes that. Telehealth allows patients to virtually connect with healthcare professionals through their phone, computer, or tablet. This shift expands access for people who might otherwise struggle to get care, including patients in rural communities, those with limited transportation, the elderly, and people managing chronic illnesses. For providers and health systems, telehealth reduces no-show rates, increases flexibility, and supports continuity of care. For patients, it brings healthcare directly into their home in a way that is safe, personal, and convenient. Telehealth is no longer a backup option. It has become a core part of modern healthcare delivery. To understand telehealth as a system, we must look at the four major perspectives that shape it. From the patient perspective, telehealth must be easy to use, accessible, safe, and convenient. Patients want a smooth virtual experience that still feels personal and trustworthy. From the provider perspective, successful telehealth requires strong training, standardized workflows, and reliable tools. In my blog, I emphasize the importance of staff training, not just for technology, but for communication, etiquette, patient privacy, and maintaining quality of care in a virtual setting. From the policy perspective, laws and regulations determine what services can be delivered through telehealth, how providers get reimbursed, and how privacy is protected. Licensing and reimbursement rules strongly influence whether telehealth expands or shrinks. From the telehealth and business perspective, platforms need to be secure, user-friendly, and interoperable with health record systems. Business models must support long-term financial sustainability for clinics, hospitals, and startups alike. These four perspectives work together, not separately, but they work together to create the telehealth system we rely on today. So they kind of interact with each other. It's kind of important to recognize that telehealth is an interconnected system. A shift in one area can immediately affect all the other areas. For example, when a patient expresses a new need or preference, healthcare organizations and businesses adjust their services and platform designs accordingly. If providers receive comprehensive training, the quality of virtual care rises. That increases the patient trust and encourages policymakers to support long-term telehealth legislation. If reimbursement policies change, providers may reduce or expand the telehealth services they offer. That directly affects patient access and influences whether technology companies continue investing in innovation. If technology improves, with better interfaces, stronger cybersecurity, or AI-supported decision tools, patient satisfaction increases and providers are more likely to adopt virtual care. Because of this interconnected structure, collaboration across sectors is not optional, it's essential. Providers and technology developers must work together to build platforms that fit real clinical workflows. Policymakers and healthcare organizations need to coordinate on reimbursement models that support high-quality, accessible virtual care. Patients and business leaders help shape telehealth innovation by identifying what works, what doesn't, and what needs improvement. When all of these groups communicate and collaborate, telehealth becomes more efficient, equitable, and sustainable. Without collaboration, each sector operates in isolation and the system becomes unstable. Sustainability is one of the most important goals in telehealth, and it starts with a strong foundation. Healthcare organizations need comprehensive staff training so providers feel confident delivering care virtually. Training also ensures patient privacy, proper communication, and consistent clinical quality. Next, organizations must create standardized procedures, clear guidelines for scheduling, documentation, follow-up care, and emergency protocols, so people receive the same level of care online that they would in person. Sustainability also requires ongoing evaluation. Telehealth systems should evolve based on patient feedback, staff input, updated research, and policy changes. Cybersecurity and HIPAA compliance are essential, especially as technology becomes more advanced and data travels across multiple platforms. A sustainable telehealth system is one that adapts, modernizes, and improves continuously while keeping patient experience at the center. Looking ahead, telehealth is one of the most rapidly evolving parts of healthcare. We're already seeing the rise of AI-assisted triage, remote patient monitoring using wearable devices, and virtual specialty care. As policies evolve, we can expect broader insurance reimbursements and more flexible licensure rules that allow providers to reach patients across state lines. Hybrid models, blending in-person and virtual care, will likely become the standard. Patients will enjoy more personalized and continuous care, while providers will benefit from the improved efficiency and better patient engagement. Most importantly, telehealth has the potential to promote equity by expanding access to underserved communities nationwide. The future of healthcare will be more connected, more digital, and more patient-centered, and telehealth is at the heart of that transformation. To wrap it up, telehealth is not just a video call. It is a coordinated system that connects the needs and priorities of patients, providers, policymakers, technologists, and business leaders. Each perspective influences the other, and the success of telehealth depends on thoughtful collaboration across sectors. With strong training, structured workflows, secure technology, supportive policy, and continuous evaluation, telehealth can deliver care that is more accessible, more convenient, and more personal than ever before. Thank you for your time, and I appreciate the opportunity to speak with you today as a telehealth consultant. I look forward to any questions you might have.